Hey everybody, my name is Kenny Bonus and I'm a CPA from Bonus Accounting. I'm a board member of the United Way of Southwestern PA and a member of the Bridges Society. On behalf of myself and United Way's regional Bridges co-chairs, Laura Miller and Courtney Murphy, I wanted to welcome you to the third installment of United Way's Good Point series. Welcome new Bridges members and welcome back to those of you who renewed your membership again this year. If you hadn't had the opportunity to join or renew your membership this year, we are going to drop our contact information in the chat. Please reach out to learn how to make your pledge. We love hearing from you, so please feel free to write in the chat during today's event. After 12 years as Oncology Medical Director of the Richard G. Lobb Cancer Center in Katanning, PA, Dr. Selvaggi pursued her interests in palliative care. After completion of her fellowship at Dana-Farber Cancer Institute, she returned to Pittsburgh to develop the Division of Palliative Care for the West Penn Allegheny Health System and became the chief of the division in 2008. Dr. Selvaggi was soon recruited back to Boston to direct the Intensive Palliative Care Unit at Brigham and Women's Hospital Dana-Farber Cancer Institute, DFCI, and shortly afterward became a fellow of the American Association of Hospice and Palliative Medicine. In the years following, Dr. Selvaggi spent time as an assistant professor of medicine at Harvard Medical School, served as clinical director for the Division of Adult Palliative Care at DFCI, directed the palliative care program for the Butler Health System, was recently promoted to Chief Community Health Officer for the Butler Health System, and is a clinical assistant professor in palliative medicine at Penn State Health. Early in 2021, she spearheaded the launch of the Butler Health System Food Institute, the first of its kind in the Butler region. The Food Institute specializes in healthy eating for the whole family and connects families to lifestyle coaching and community resources to improve overall health. It is my pleasure to introduce Dr. Kathy Selvaggi.
Thank you so much. First of all, I just, thank you so much for inviting me. And, my job right now is to tell you a little bit about myself and how I got here. And I think most of you don't know me. So I'm going to start off by saying this is one of my favorite quotes. I'm not sure who said it, but it is hanging in my office. And this sort of tells you everything you want to know about me. And it says, don't tell me the sky is the limit when there are footprints on the moon. And this has really been sort of my story. And I want to start off by saying, I was born and raised in Erie, Pennsylvania. I went to Mercyhurst High School, which is a small private high school. I'm one of 4 children. I'm the third. So I'm that middle child, a little bit devilish, very, what do I want to say? I follow my own, I beat to my own drum, and I don't take no lightly. Almost never have taken no lightly. So to give you an idea, I had said to my parents, both of my older sisters went to smaller private schools. And I said, I'm going to go to a big university. I want to be a number. I will try to keep it east of the Mississippi. And they said, and by the way, my guidance counselor did not think that that's what I should do. She thought I should go to a small liberal arts college. And I said, but that's not what I want. So I applied to University of Michigan, University of Illinois, University of Wisconsin, and Purdue University. And my dad wanted me to apply to Case Western because my sister went there, which is a smaller college in Cleveland. And I applied to appease him, knowing full well I wasn't going to go. And for those of you, I'm older, right? I was born in 1957. So when I applied to colleges, there was that catalog book. There was no internet, right? There were no cell phones. All you youngsters had all that. And so I picked my college by going through a catalog. And I went, okay, these are big universities. They're good in science, blah, blah, blah. I think this. So long story short, I get into the University of Wisconsin and I go, this is where I want to go. So sight unseen, by the way, I didn't visit any of these campuses except Case Western. So it comes time to go to college, and my mother says, well, your father and I are driving you out there. I go, no, you're not. I said, I'm getting on a plane. So I packed up my stuff. I got on a plane, went to UW-Madison, never saw the school, by the way, until I got there, and fell in love with it and stayed for 6 years and got a bachelor's and a master's in microbiology, because I thought, okay, I think I'm going to be a scientist. So, I do my master's degree, and I loved my major professor, Dr. Hansen. I liked research, but I didn't love research. And he was very disappointed. I completed my master's degree, and at that time I had volunteered in a hospital and went, well, I think this is what I want to do. Well, at the time, if you're getting he felt that being a PhD was that being an MD meant that I was less smart than someone who was getting their PhD. And so he really discouraged. He goes, Kathy, you really need to get your PhD. And I said, Dr. Hansen, I like this work, but I don't love this work. This is not my passion. And I need to find what I love to do. So despite the fact I did finish my master's, and I did disappoint him, I'm sorry about that, Dr. Hansen, but I applied to medical school. And which is where, if my husband is on the line, which is Dr. Don Vigliotti, is where I met my husband, fell madly in love anyway, right, Don? And, we got married. So, and what I found is that I loved medicine, right? And I loved adult medicine. I loved the challenge. I loved caring for people. And it really fed my soul. And I think what is important is, despite some of the crazy advice I've gotten along the way, I think it's really important that you are passionate about what you do. And sometimes the advice that you get, you can't listen to it. And although it was, I did meet resistance with my major professor, Dr. Hansen, who I totally loved. It just is not what I wanted to be when I grew up. So, fast forward, we go through medical school at Penn State. Don and I get married in Penn State, in Hershey. And it was the first year we graduated medical school in 1985. So you can start doing the math. Yes, I'm 64 years old. And Don became a pediatrician. I went into internal medicine. And the funny story about this is, as we're looking for residency programs, we applied to many, many programs around the country because we had no idea where we were going to land. Well, growing up in Erie, Pittsburgh was sort of an ugly city, I just want to tell you. And so it was our last city where we had an interview, Don at Children's and me at Presby. And I said, oh, Don, let's just bag Pittsburgh, because I'm telling you, it's such an ugly city. But realizing I had not been here in like 10 years. So we're driving through the Fort Pitt Tunnel, right? And all of a sudden you see gorgeous downtown Pittsburgh, of which Don says, what are you talking about? And I said, you mean this is Pittsburgh? Needless to say, we matched here in Pittsburgh. Thought for sure that, we'd only be here for a couple of years, and voila, here we are. So, so I did internal medicine and then went on to do hematology, oncology. And I was a bone marrow transplanter for a while. And again, as my career progressed, Armstrong County really needed an oncologist. There were very few. And so I decided to take that job. And to the disappointment and chagrin of some of my University of Pittsburgh professors, because they said, Kathy, we can't believe you're leaving academic medicine. And once again, and some of the advice wasn't so great. One of them, someone said to me, who's no longer there, if you leave academic medicine, Kathy, we will never let you back in. And I remember saying, and I did say, I said, Dr. So-and-so, you can't take away my husband. You can't take away my children. You can't give me a terminal illness. And I have a brain. And if I want to get back into academics, I might have to take a circuitous route, but I'll get there, and so I really did listen. And that's sort of, the way of my life. And so I developed the Cancer Center at Armstrong, which is still there today. And the other thing that was so much fun is, and you all will love this story. So at the time that I was at Katanning, Punxsutawney called me, the CEO there, and he said, Kathy, we need an oncologist. Now, Punxsutawney is another hour from Katanning. And he said, do you think you could come up once or twice a month? I said, sure, let me try that. But he goes, we have no space, so we have to put you in a trailer. And I said, well, if you can give me heat and you can give me running water and, a decent place for the patients to sit, I'll see cancer patients anywhere. So my office was a trailer. And it was so cool. We loved the trailer. Although one time we did have a mouse, but so we developed a cancer center in Katanning, and that is still going strong, right? And we developed the cancer center in Punxsutawney. They now have a building. So the trailer, it was sort of a sad day when the trailer was gone. But what I loved about that was I got to meet people where they were. I took care of the Amish. I took care of people who had to travel an hour to see an oncologist. It was just, it was my passion, right? It's what I love to do. And because I thought, my goodness, you're at these major medical centers, which are great and we need them, but there's lots of resources. But when you go to rural America, where you have these hardworking people, they have nothing. So they had me. And, I did home visits, Route 85, I can still remember some of the homes I stopped and got lost, by the way. I did get lost one time and had to ask somebody for directions. And you're in rural America when they say, okay, doc, just go, it's down the road a piece and there's an oak tree on the right. And I went, oh my God, but I did make it home. I did get lost in places that I can't even remember, but the people were genuine, they were kind, and they were so thrilled to have a doctor. And also I think, we learn through adversity, right? So, and we all have adversity in our life. So I can tell you that during my third year of medical residency, this is before I started my hematology oncology fellowship, my mother died very young. Well, I thought 58 was young, of metastatic breast cancer. And this was 4 months after our son was born. And what was interesting about that is if you say to me, I can tell you so much about that day, it still gives me a visceral response. It was probably the worst day of my life, but it was also one of the best. And why that's the case is that living through that experience and being on the other end, my mother died at Cleveland Clinic, and it was excellent care, but she was young, was that it made me a better physician. And when patients ask me, Dr. Selvaggi, do you know what this is like? I do, because I was on that receiving end. And she received great medical care. But I remember when she was in the ICU, one of the residents came out, and I'll never forget him, because I was sleeping on a chair, and he came out and said, Kathy, I think your mother is not doing well. And he was so kind. He brought me a glass of water. I remember the nurses who took care of my mother, who made sure that she was clean, that her skin was massaged. And I realized it's those little things that are not so little. And I don't want to make people cry, even though I'm getting teary-eyed, but these are the things that matter, right? It is, again, it's that passion. Those are the people that I will never forget. And I wanted to make sure that that was the kind of doctor that I was or would grow up to be. So thank you, Mom, for teaching me that. It's a lesson that I will take care with me till the end of my life, that this is what matters. And, you fast forward and I fell in love with palliative care because I love taking care of people with terminal illness or having difficult, challenging conversations, right? Because we're none of us are leaving here alive. And it's important that you have someone talking to you and caring about your loved one, that you are honest and open enough to have these sort of discussions, and can make a difference in someone's life, in someone's family. And so when I had the opportunity to go to Boston to do a palliative care fellowship, and again, I commend my family for saying, go for it. Our daughter was in 8th grade. Our son was starting Purdue University, and Alyssa said, Mom, you can go and do a fellowship. Just promise you'll come back for high school. I said, on it. And I'll give you an example of what we taught our children. So, I went from Armstrong County Memorial Hospital, right, in Catania, Pennsylvania, which Boston hadn't even heard of. And I'm the oldest fellow, by the way. I was 48 when I went back to school. So I go up there. So we didn't even have EMR in Catania. We had paper charts. So I get to Boston, everything is high tech. And I'm like, oh my God, how am I going to learn this? And I remember walking home from work one day and I call Alyssa, and because now there are cell phones. And I say, Alyssa, who's now in 8th grade, right? And I go, Alyssa, why did you let your mother do this? Like, why didn't you say, you are a crazy woman? And she wrote me this letter, which I still have, saying how proud she was that I would do this, that what a role model. And she goes, Mom, you can do this. You can learn the computer. You can do it. It's not that hard. You have a brain, do it. And I still have that letter. So here's my 8th grade daughter, right? Sending me, and she would call me once a week at least. Well, probably once a day. I said, Mom, how's it going? How's it going? So, what she taught me, and our daughter now is a pediatric resident at Children's Hospital of Pittsburgh, and will be following in her father's footsteps and will be chief next year. But she said, your example, the example that you set for me and for my friends is important. And, I can tell you when she was in NYU, she went to NYU undergrad, and our son went to Purdue. And I can tell you how many times professors or teachers, I mean, there was a lot of excellent ones, but I remember Alyssa calling me because she got a C on her first organic chemistry. And she was told she would never get into medical school. And she was very sad on the phone. I go, well, I said, let me tell you why the sky is full of, I'll say crap, because I think I'm being taped. I said, because he's your organic chemistry professor, right? And so after 18 or 20 years, he should know his organic chemistry. I said, just study and you'll do fine. You'll get into medical school if that's what you want to be. And, this is what I tell young people is, if you have the drive and if you want to do it, you have to work. If you would have said to me, Kathy, would I've gone from Catania, Pennsylvania to Harvard Medical School, I would have said, no way. But I wanted to get there. And so sometimes your dream, you don't get to your dream in a straight line from A to B, but you have to take a circuitous route. And so even now, fast forward, I can tell you that when I left Boston for Butler Health System, my friends in Boston told me that I should have an MRI of my brain. Like, oh my gosh, how could you leave Mecca for Butler? Because Butler needed a palliative care program. And I thought, what the heck? I think I can build it, because what's the worst that happens? I bomb and I do something else. And this is what I tell people. It's a job. It's not a life-threatening illness. It's not losing your family. It's not losing those important things that anchor us. It's a job. And I had the support of Butler Health System, by the way, and we built it. And it's booming, the palliative care program. And I hired Dr. Dylan Stein from UPMC, who's brilliant and a great clinician and loves patient care. A PA from Boston came with me because her family lives in Mars, and she knocked on my door one day in Boston and said, Kathy, are you really moving back home? I go, I am, because, I commuted. Dawn lived here. I lived in Boston. So man, US Airways did quite well off me. For 5 years, I traveled. and got to know my pilot, Jody, by the way. But it's just that you take chances, and I think I don't want to say that I've been given a lot of bad advice, although I have. I've also been given some good advice. But what I've learned and continue to learn is that searching and going for what feeds your soul has never let me down, and that we are going to face adversity. You can choose to let it dominate your life, or you can choose to say, these are the cards that have been dealt. How do I make lemonade out of the lemons? And that's how I try to live my life. And still, when I'm teaching young doctors or young residents or just young people, it's go after what you want. And there are times along the way that they're going to say no. Well, then you just skirt it and figure out how to develop your plan anyway. And so interestingly, this year, actually at the end of last year, the hospital said, Kathy, our social determinants of health, our community is poor. We have food insecurity. We have mental health issues. We have chronic illness with obesity and cancer and diabetes and heart disease. What do we do? Because, for those of you who don't know, when you are a nonprofit health system, you have to do a community needs assessment. And so knowing our community needs assessment and the multiple health issues that are out there, they developed this basically a new job description, and it is Chief Community Health Officer. And so they said, can you do it? I said, what the heck? Let's try. So, this is a completely new job. I'm writing grants. I'm learning about nutrition and diabetes and heart disease and things that I really haven't thought about for a while, because the goal is, in our community, everybody thinks Butler's a wealthy community. Well, if you're in Cranberry and Seven Fields, yes, but where we're located, where our hospital is, pre-COVID, guys, we had a 30% poverty level. That is significant. And you go north of us and it's even poorer. So we are looking at, if we are going to change the course of generational poverty, we have to step in and do something about it, which is why, we've partnered with you all and partnered with United Way and the Center for Community Resources and A&R, and really working with our community leaders. And I think there is a question somewhere about the Food Institute, which is a very cool project we're working on. We're doing a lot of really, really cool things. And again, I have to tell you that I have spoken to some people, some higher up in government, who have said, do you really think you can make a change? Do you really think that you are going to change the outcome for these people? And my answer is absolutely. But you have to start somewhere, right? Will I see it in my lifetime? I hope so. And when we get to the question about the Food Institute, I can tell you about that. I absolutely think we can make a difference, because I've seen it in the course of my career. So I don't know, Kenny, if I can keep going. Maybe I have a few more seconds, but again, I have loved the field of medicine. If you ask me, even with all the changes, would I do it again? The answer is unequivocally yes. It has afforded me it's an amazing field, and I've met wonderful people. I've taken care of wonderful people. I've learned a lot from my patients who have died. They have taught me how to face adversity. They have taught me how to die with dignity. I would not change my field for anything. So yes, I would absolutely do it again. And it has afforded me the ability to move on and do some other very exciting things. And, Erin Stewart's on this. She's a nurse that I work with here in Butler, and, we're going to change the world. So I figured I'm on the second half of my life, so I got to speed it up, but we're going to do it. We're absolutely going to do it. And I'm hoping that we can be a model for other health systems throughout the country. Do I keep going, Kenny, or do I ask about questions or what do we do now?
Yeah, I think Jamie has a question for you.
Hi, Dr. Selvaggi. Thank you so much. That was amazing. I feel like I can go out and change the world now
You
too.
can.
So
You can.
thank you so much for what you're doing for rural health. It's fantastic. So I just wanted to hear more about the Food Institute and what inspired you.
So, and it's really cool. And again, I just want to say it's a team and I get to work with wonderful people like Aaron Stewart. So what we know is from our 2019 needs assessment that food insecurity was a significant problem in our area. So if you go to downtown Butler in the 16001 zip code, which is where our hospital sits, we are a good 5 miles away from Giant Eagle. The grocery stores are Rite Aid, Dollar General, and we have a small store, Miller's Meats, who does wonderful things, but certainly cannot support the needs of our community. We also learned that people don't even know what they don't know. So if you hand them a zucchini, they will throw it out because they don't know what it is. We have learned that people don't know what a fresh carrot is. They've never seen it. They've only seen the carrot in the bags. So we developed, and the hospital system was 200% behind this project. We had a retail cafe on the first floor. And what they did, Jamie, is they said, okay, Dr. Selvaggi and Aaron, the space is yours. So it is no longer a retail cafe. That is our Food Institute. That and this cafe, had refrigeration, freezers, a kitchen. It's fantastic. What I did not know, because I knew nothing about refrigeration, was if we had to build that space today, it would be close to $1 million. So you see the investment that the hospital made. So the Food Institute is this. We have this now through the electronic medical records throughout our health system. So if you go to the physician, whether it is a primary care doctor or a subspecialist, you are asked one of three questions. You're asked three questions, and these are hunger vital signs that are approved by the Center for Medicare and Medicaid. Do you run out of food before the end of the month? Do you run out of money to buy food before the end of the month? And do you have difficulty accessing fresh fruits and vegetables? If the answer to any of these questions is yes, doesn't have to be all three, and we do not care what your insurance is, or if you don't have any insurance. If any one of these are yes, you are referred to our Food Institute electronically. We have a nutrition tech who's in the Food Institute 5 days a week. Her name is Brianna Lamberger. She's the most dynamic young person you ever want to meet, although she does cry at everything. And I'm saying she cries when she's happy, she cries when she's sad, but the woman is a dynamo. So when you are referred, you get educated. So that referral is good for once a month for 6 months. And you get 10 healthy meals, Jamie. What's good though, is each meal feeds 4 people. So you're getting 40 meals. And you are getting, healthy oils, you're getting rice, everything is healthy foods. And Brianna is teaching you. So with each, we're not a food pantry. You're being taught on my plate, on what is a low sodium diet, what is a low sugar diet. And you're leaving here with like 10 bags of healthy foods. And that goes on for 6 months. Now, what's very cool is we are already noticing the patients are reporting their A1C is going down, their blood pressure is going down. And here is where we parted with United Way, because we also knew that people did not have utensils. So we have a Smile account through Amazon. We have a wish list that you guys help us set up because I can't do that stuff. And you can go on. We have a list of the needed items people purchase, and they come right to our Food Institute. So we have people who needed can openers. We have a person who was using his socks as hot pads. We have people, so without forks and spoons or knives. So we had one gentleman who came who has it's not Parkinson's disease, but he does have a significant tremor. that regular forks and spoons he couldn't eat. So we were able to purchase the weighted utensils. So these are the things that we are doing. And the other thing that's cool is, along with this, Erin Stewart and her group, way before me, developed these lifestyle coaching classes that are now on Zoom. And we are Zooming these classes all over the county and multiple counties. So it's healthy diet, diabetes education, heart healthy. And we're Zooming these classes from into Butler County, Clarion County, Armstrong County, Indiana County, and Venango County. And I can tell you that in 2020, we had about 440 participants. In 2021, we've had over 1,000. So this is really cool work. So making a difference, guys. And again, right, if people would have said, can you do this? We're doing it. We're doing it.
Hi, Dr. Selvaggi, Laura Miller from UPMC Health Plan. How are you?
Good, Laura, how are you?
I'm great. I'm so excited. Thank you so much for taking the time with us today. My question is a little off script. You are in palliative care, which has to be emotionally taxing,
Yes.
period. And you're in an industry right now that is more emotionally taxed than ever. How do you advise other healthcare workers, how to take lemons and make lemonade and just build that resiliency? Because what started as a pandemic, we thought we were just going to be a few months, has turned into an endemic. So what advice can you share for the group?
So, I think that you do have to take time for yourself, and you have to acknowledge that that is not a selfish act. So I will tell you, and as my husband can attest, I bake, and I bake probably 4 to 5 times a week. And I bake for Meals on Wheels. I bake for different agencies because that feeds my soul. And so, is it selfish? Perhaps, because I do love giving. I think giving is important. But it also, so I think you have to find, is it meditating? I will tell you, I'm not a good meditator. I wish I was. I get too antsy. I think it actually raises my blood pressure more than anything, but there are some people that meditate. The other thing that I've resorted to is I don't listen to the news anymore. I rarely. So when I get up in the morning, Don will also attest to this, I put on my Pandora and I listen to music. So I think there's not a one size fits all, Laura. I think it's a really great question. I think we're stressed a lot. But I think what I know when my cup is emptying out, and I have to refill it. So is it walking outside? Is it reading? Is it eating some chocolate or drinking a cup of coffee? I do bake a lot for the hospital. I do. So I bring in baked goods to the ICU teams, to all the COVID teams, because they love my baked goods, and it makes me feel good that I'm helping them. I also think that, we brought in a massage therapist for our staff. We are going to, I was telling them earlier before we started, we are purchasing this decadent peanut butter pie that everybody loves, and everyone's going to get a slice here for Christmas. They just don't know it yet. I think that it is not selfish to recharge, and you have to do it. Sometimes you have to take a day off. I will tell you that it's very hard for me at the end of the day to talk on the phone. I will talk to my children, but I have to limit who, because I talk all day. And I tell people over and over again that it's not selfish. I stop docs in the hospital because I will tell you that there is frustration for those that are not vaccinated by those that are vaccinated. And I let these doctors and nurses vent and acknowledge that their feelings are real. There are days, Laura, that I can't hear one more sad story. And so I say that I just can't do it. That's not a perfect answer, but I want people to know that self-care is crucial. because otherwise we will burn out, and what a waste of talent. And that's what I worry about. I don't want that talent to be wasted.
Thank you so much.
You're welcome. Oh, wait, you're on mute.
Sorry about that.
That's okay.
Thank you for making time out to make changes in our communities. I work with residents and fellows all the time in Allegheny Health Network, so it's kind of a joy to hear the success story. What would you say is the most important risk you have taken and why?
Okay, so as a joke, I was going to say marrying Don Vigliotti, but that's a joke. No, you know what? I think probably, gosh, I've taken a lot of risks, but probably the biggest one was taking the job in Boston. You know, and I will tell you, because first of all, I knew that, well, by that time, Alyssa was starting NYU and our son was in Chicago and Dawn was here in Pittsburgh. But it was a big leap, you know. I thought, and you know, deep down, I'm going to be honest, I questioned, oh my gosh, Kathy, can you really do it? Can you really go into this high-powered quaternary healthcare system and make a difference and make a change? And so, you know, I did have a little self-doubt. I would be lying if I told you I didn't. But then once I got there, I thought, you know, I mean, these people are smart, but I'm not sure that they're a whole lot smarter than I am. And I think if I work hard, I can do it. Now, it is interesting. I will tell you that I did have, you know, some Harvard professor say to me, because if you look at my education, right, I went, you know, I'm from Erie. I think he heard of Erie, but, you know, they don't know where Erie is. I went to University of Wisconsin State School. I went to Penn State Medical School, State School, and then I came to Pitt. And I did have someone say to me, you know, I can't believe they let you in here. I mean, you didn't go to an Ivy League school. And my retort to that was, yeah, but I'm pretty smart anyway. You know, we state educated kids aren't too bad. So, you know, there was some of that, you know, there always is. But, you know, I just stepped up to the challenge. And again, I think I was not going to let fear dictate my life. And I thought, again, what is the worst that happens? The worst that happens is I'm a bomb, it doesn't work out, and I go back home to a family that still loves me. So it sort of set that priority. I think that sometimes barriers are placed because of where you're from, right? Male or female, color of your skin, and they're stupid barriers. I mean, we have brains. We can, I mean, I can't be an opera singer because I don't think I've got the right set of pipes, but I do have a brain and I can figure things out. And I think the other thing that I really want to stress is I could never get where I would not be where I am without an incredibly supportive family and wonderful people that I worked with. You know, to do what we do takes a team. It takes a team. And it's not only Kathy Selvaggi, it's a team of really good, incredible people. And again, for that, I'm so thankful. One person never does it alone, by the way, even if they tell you that it's just them. That's not true. It's not true.
Thank you so much.
You're welcome.
Hello, Joe Yezovich from Heffron Tillotson here. Appreciate your time and very much enjoyed hearing about your journey. Love the quote, by the way, as well. My question for you is, what qualities would you say are lacking among our leaders, among today's leaders?
Yeah, so, you know,
Thank you.
Yeah, let me reframe that a little bit to say what's really challenging for our leaders today. And let me tell you what I think they are. I think that we are so used to, and I don't want to sound like an old lady, but I think to make decisions, you can't do it with pieces of information. We get a little soundbite and we want a decision. And I think that's a mistake. So I think one of the challenges for leaders is, number one, you need to get your facts and you need to hear from all walks of life. I'm here in the administrative suite, but before I make a decision, I talk to the nurses, I talk to the docs, I talk to the frontline workers, I talk to the people who have the boots on the ground, because those are the people that are in the trenches. I think that is critical. And I have done that all my life, and it has served me well. I think that the other thing that's important is when you are a leader, you know, one of the other things my mother taught me is, she says, Kathy, if you go through life and everybody loves you, you've made a mistake, or you've never made a decision. Because when you make and I think that's true, when you make a decision, someone is going to be upset, and they're not always going to love you. But the important thing is that you have to be fair and equitable and firm. And I think that's true. I really do. I can tell you that, you know, when I was in Boston, I had some very challenging situations, but I listened and listened and listened and got the data and never, I know, you know, it's like when people get mad and they want to send off that stupid email, what I would tell these young doctors is, do not send that email. You hold on to it and you look at it tomorrow and say, do you really want to send that? Now, I'm not saying I haven't made mistakes. Have I called someone a jackass that I wish I could take that back? Absolutely. So we learn from our mistakes. But I think it is imperative that as a leader, you are in the trenches, you know, your team knows that you are, and that your goal is to be fair. And you got to look at the whole system, right? I mean, you look at Butler, we employ 3,000 people. It is the largest employer in Butler County. Decisions to, you know, to shut down certain areas are huge. It would have a big economic impact for our community. These are decisions that you can't take lightly. And sometimes what I worry about is that leaders have one ear, they're listening to just one population or one group, and they're not looking at the impact of their decisions. And I think that's a mistake. I do. I also think sometimes, certainly in medicine, people are promoted to their level of incompetence, right? We all have worked with people that should not be in a leadership because they don't have a skill set. And I think that also, I can tell you that I worked with a physician who was put in a position. She absolutely did not have the skill set, and she was failing miserably. And I took her aside and said, okay, I know you're going to view this as a demotion, but I want to take you out of that position and let's get you the training you need. She didn't like me for a while, but I know in the end, I did the right thing by her. And I will always believe that. So I think it's important that when we are going to develop leaders, that we truly develop them. And just because you're a doctor or a lawyer or a whatever, doesn't mean you can lead people. And that is a skill set that you need training for. There are very few, right, born leaders, but all of us have a brain and we can learn. I hope that answers your question, but I think we have to be careful and we have to listen when we're a leader.
Excellent. Thank you very much, Dr. Selvaggi, for an inspiring hour. I know that your words definitely resonate with me, and I know that they speak to everybody who is here today. We're glad that you all could join us today. Connecting with leaders like Dr. Selvaggi and access to exclusive events such as the Good Point series are just some of the benefits of Bridges Society membership. One of the most important benefits of membership is the impact of your generous gift. Your leadership gift of $1,000 helps 2 Southwestern PA families through a short-term crisis by paying their utility bills, which helps prevent utility shutoffs. 700 members strong, Bridges Society, our members' leadership and generosity drives change in Southwestern PA, and we cannot thank you enough. I encourage you to tell your friends about Bridges, invite them to the next Good Point series, or to an upcoming volunteer event. We are hosting a toy collection drive for Beverly's Birthdays, an organization that provides birthday cheer for children experiencing homelessness and families in need. Join us February 12th to drop off the toys we collected and volunteer at their warehouse to help sort out the toy donations. This is a family-friendly event, and we'll be dropping details in the chat here. We're looking forward to 2022 in spring weather, and then in April we'll be hosting a park cleanups in Allegheny, Butler, and Westmoreland counties. Don't miss out on these and other ways to give back, so sign up for the Next Gen newsletter for the latest opportunities. I want to thank you again for attending and supporting the important work of the United Way. We look forward to seeing you next time.
Can I just end on one quote?
Definitely.
So I love Mr. Rogers. No, I want to share this with you because I think this says it all. And this is a quote from Mr. Rogers. The thing I remember best about successful people I've met all through the years is their obvious delight in what they're doing. And it seems to have very little to do with worldly success. They just love what they're doing and they love it in front of others. And so again, I love Mr. Rogers. Right? This is what we're all doing. And we don't have to be the president of a corporation, not that that's not a good thing, but everything that we do matters. It matters. This morning I went down to buy my Cummings coffee and there was a gentleman in line and he looked a little distraught. And I said, you know what, sir, I'm going to buy your coffee for you. And he said, why are you doing that? And I said, because someday you're going to pass that on to someone else. And this is my Merry Christmas to you. And again, right, it is the small things that will change the world. So I will leave you with that. Guys, we can do it. It may take us a while, but we can change the world one brick at a time.
Definitely. Thank you so much for all your time, and happy holidays to everybody who's here. Appreciate it.
And stay safe, everybody. And thank United Way, great organization. And now you're stuck with both me and Dawn.
Thank you both.
All righty.
Thank you, everyone.